very important that you follow these instructions carefully. The after effects of oral surgery are quite minimal, so not all of the instructions may apply. Follow these guidelines or call our office for clarification. Our number is 615-591-0919. Bite down gently but firmly on the gauze packs that have been placed over the surgical areas, making sure they remain in place. Do not change them for the first hour unless the bleeding is not controlled. The packs may be gently removed after 1 hour. If active bleeding persists, place enough new gauze to obtain pressure over the surgical site for another 30 minutes. The gauze may then be changed as necessary, typically every 30 to 45 minutes. It is best to moisten the gauze with tap water and loosely fluff for more comfortable positioning. Do not disturb the surgical area today. Do not rinse vigorously or probe the area with any objects. You may brush your teeth gently. Please do not smoke for at least 48 hours since this is very detrimental to healing and may cause dry socket. Intermittent bleeding or oozing overnight is normal. Bleeding may be controlled by placing fresh gauze over the areas and biting on the gauze for 30 to 45 minutes at a time. Bleeding should never be severe. If so, it usually means that the packs are being clenched between the teeth only and are not exerting pressure on the surgical areas. Try repositioning the packs. If bleeding persists or becomes heavy, you may substitute a tea bag soaked in very hot water, squeezed damp dry, and wrapped in moist gauze for 20 to 30 minutes. If bleeding remains uncontrolled, please call our office. Swelling is often associated with oral surgery. It can be minimized by using a cold pack, ice bag, or bag of frozen peas wrapped in a towel and applied firmly to the cheek adjacent to the surgical area. This should be applied 20 minutes on and 20 minutes off during the first 24 to 36 hours after surgery. If you have been prescribed medicine for the control of swelling, be sure to take it as directed.
Most oral surgery is accompanied by some degree of discomfort. You will usually have a prescription for pain medication. If you take the first pill before the anesthetic has worn off, you should be able to manage any discomfort better. Some patients find that stronger pain medication causes nausea, but if you precede each pill with a small amount of food, chances for nausea will be reduced. Try to keep taking clear fluids and minimize the dose of pain medications. The effects of pain medication vary widely among individuals. If you do not achieve adequate relief at first, you may supplement each pill with an analgesic such as aspirin or ibuprofen. Some patients may even require 2 of the pain pills at one time. The most severe pain is usually within 6 hours after the local anesthetic wears off. After that, your need for medication should lessen. If you find you are taking large amounts of pain medication at frequent intervals, please call our office. If you anticipate needing additional prescription medication for the weekend, please call for a refill during weekday business hours. Eat any nourishing food that can be taken with comfort. Avoid extremely hot foods, acidic foods, and carbonated beverages. Do not use a straw for the first few days after surgery. It is sometimes advisable, but not absolutely required, to confine the first day's intake to liquids or pureed foods, such as soups, puddings, yogurts, milkshakes, mashed potatoes, oatmeal, and the like. It is best to avoid food like nuts, sunflower seeds, popcorn, chips, which may get lodged in the socket areas. Over the next several days, you may gradually progress to solid foods. It is important not to skip meals. If you take nourishment regularly, you will feel better, gain strength, have less discomfort, and heal faster. If you are diabetic, maintain your normal eating habits or follow instructions given by your doctor. If you feel something hard or sharp edges in the surgical area, it is likely you are feeling the bony walls that once existed to support the extracted tooth. Occasionally, small slivers of bone may work themselves out during the following week or so. If they cause concern or discomfort, please call the office.
Instructions for the second and third days. Keeping your mouth clean after surgery is essential. Use 1/4 teaspoon of salt dissolved in an 8-ounce glass of warm water and gently rinse with portions of the solution, taking 5 minutes to use the entire glass full. Repeat as often as you like, but at least 2 or 3 times daily. Begin your normal oral hygiene routine as soon as possible after surgery. Soreness and swelling may not permit vigorous brushing. Make every effort to clean your teeth within the bounds of comfort. Avoid any alcohol-based mouth rinses, e.g. Listerine, Scope, for the first few days. You may apply warm compresses, hot water bottle, hot moist towels, heating pad, after 36 hours following surgery to the skin over the areas of swelling for 20 minutes on and 20 minutes off to help soothe tender areas. This will also help decrease swelling and stiffness. On the fourth day, you should be more comfortable and, although still swollen, can usually begin a more substantial diet. The remainder of the postoperative course should be gradual, steady improvement. If you don't see continued improvement, please call our office. If you are given a plastic irrigating syringe, do not use it for the first 5 days. Then use it daily according to the instructions until you are certain the tooth socket has closed completely and that there is no chance of any food particles lodging in the socket. If you have questions about your progress, please call the office. If you call after business hours, please listen to the message, and it will leave you a phone number at which you may reach myself in the event of an emergency. Telephone calls for narcotic, painkiller, prescription renewals are only accepted during office hours. I can speak for everyone here when I say that we are committed to your health and a speedy recovery.